Now that the castor oil and DMSO are eating away at whatever clog is in the glands that produce that mucus, it's starting to break up and the debris is getting pushed out, which is all the crusty that you find around your eyes when you wake up in the morning, right?
Yeah.
So now that that's happening, what we want to do is go in and do surgery to actually make it worse. We're going to add scar tissue. We're going to add trauma. We're not actually going to make anything stop. We're not clearing anything. We're just going to make the hole that drains even bigger, which is going to cause dry eye, which is going to cause another whole host of issues. And I'm not
Okay.
saying don't get the surgery. I'm saying give the drops time to work effectively because you've already seen some efficacy. So let's keep going for another couple of weeks. Let's see if we can get you down to 15 as far as pressure is concerned before you actually go in and have a surgery. If you're going along and everything is strong and all of a sudden your pressure starts to hike back up, you can always have the surgery. You can't always not have it.
Mm. The issue I have right now is I'm out of the 40/60. So even if I place a order today, it won't arrive until maybe next week or upper week.
Well, if you want to do a rush order, I can ship it overnight, like because you're in an emergent situation, and I think I have in stock right now 4 and 4060 that I could push out in an overnight order. Uh, even if I do ship it overnight, I can't ship it overnight on a Saturday because it won't go anywhere on Sunday. It'll go on Monday. But overnight Monday, you would get it Tuesday. Um, that's that's just the nature of shipping.
Yeah.
But there's that's all there is to it. And I'm telling you that you're going to get a better overall interaction with your eyes not having surgery at this point. You can always have surgery at some point, but you don't really need surgery right now. What prescription drops do they have you on?
Timon, I'm on
Timolol
Timolol, Bromodine,
and
Latanoprost.
latanoprost.
Yeah, I have three other drops that I don't even know their names.
Okay, so okay, Allah's bless. I'm going to mute your microphone just because we're getting background noise. So I'm happy to talk to you off the live because in this situation it's difficult for you to make an assessment and for me to know all the details. I'd love to know all the details, but from what you're telling me so far, getting to the point where your pressure went from 39 to 26 in a week, like
Yeah,
that's significant.
that's
And
four
I think that
days.
you'll be
Yeah,
4 days. So
yeah.
I think you'll be able to get yourself down into the 15 pressure in 3 weeks, and in 6 weeks normal 11, 12, 13.
Okay.
So and it's in unison with your prescription drops. So we these drops are helping the causation, and in unison with your prescription drops you're bringing your pressure down. This is the thing that kind of unnerves me about the medical community. Your situation is such, you're getting better eyesight right now. You're actually getting better pressure right now. So the one thing we want to do is go in there and do a surgery and potentially make all the rest of that go away.
Yeah. One more question, right?
Sure.
Now, because I was like, oh, my right eye is wider than my left eye. Why can't they
Mm-hmm.
treat the right eye so that I can see like the left eye? So they was telling me that like the tissues at the back of the eye has an issue that is bad. So no matter if they clean the cataract off, that the vision will still be blurry.